Thank you very much, sir. Good afternoon, everyone. Wonderful sessions and discussions since morning we had. So basically, I'll be discussing quickly two abstracts, primarily about neoadjuvant chemotherapy in bladder-sparing chemoradiotherapy patients in non-invasive, non-metastatic muscle-invasive bladder cancer. So to understand this, this study was primarily a retrospective chart review, which was performed on 56 patients who were treated with neoadjuvant chemotherapy plus chemoradiotherapy between 2008 to 2017 at Princess Margaret and Durham Regional Cancer Centers. The primary outcomes what they were supposed to study was the 5-year disease-free survival, bladder intact disease-free survival, and overall survival. To just quickly understand what the actual study protocol was, most of these patients primarily underwent maximal TURBT for muscle-invasive bladder cancer, and after that, these patients received neoadjuvant chemotherapy with gemcitabine and cisplatin 2 to 4 cycles. After every 2 cycles, the cystoscopy and imaging was done, and after further completion of the 4 cycles, cystoscopy imaging, and then patient underwent maximal re-TURBT. If there was any progression was found in these patients, then these patients were immediately subjected to radical cystectomy and pelvic nodal dissection. Those patients who had disease stability or response, then this patient was subjected to receive EBRT to a dose of 60 to 66 gray to the bladder and the pelvic lymph nodes, and concurrent cisplatin was considered for 40 milligram per meter square, which was given weekly for 6 weeks. Patients were then kept on follow-up every 3 to 4 months with surveillance cystoscopy, imaging, and urine cytology. To understand the demographics of this patient, most of the patients, the median age was around 72 years, and majority of the patient population was male. The clinical stages was stage 2, stage 3 were the majority of the patients, and in histology also, urothelial carcinoma or urothelial carcinoma with squamous differentiation were the most number of cases. In the treatment part, almost majority of the patients, or most of the patients, 95% of the patient completed the neoadjuvant chemotherapy course. The grade 3, grade 4 toxicities was not much. Only the neutropenia was, which was a more significant toxicity in almost 11% of these patients. And almost all patients completed, 100% patient completed the radiotherapy course, and majority of the patients were able to receive the radiation dose of more than 60 gray. Those patients who received concurrent chemoradiotherapy, around 86% of the patients were able to receive more than 60% of the planned concurrent chemotherapy dose. So coming to the results, the median follow-up was around 96 months. The disease-free survival was 56.6 months, and the 5-year disease-free survival was 49.2%. Median bladder intact disease-free survival was of 45.6 months, which is at a rate of 5-year survival rate of 47.6%. The median overall survival was 105 months with a 5-year overall survival rate of 62.2%. So never to be surprised, this is similar to the chemoradiotherapy without neoadjuvant chemotherapy that these patients received. So the overall survival is approximately in the same range. So as per this paper, the neoadjuvant chemotherapy plus concurrent chemoradiotherapy is a safe and effective bladder sparing approach with encouraging long-term outcomes in carefully selected patients with muscle-invasive bladder cancer. Now coming to the next paper, it is primarily a systematic review and meta-analysis where they wanted to see the efficacy of the neoadjuvant or induction chemotherapy in non-metastatic muscle-invasive bladder cancer treated with chemoradiotherapy. In this systematic review, the inclusion criteria was the study compared the neoadjuvant chemotherapy plus chemoradiotherapy versus chemoradiotherapy alone in non-metastatic muscle-invasive bladder cancer. They included both randomized controlled trials and observational studies. The exclusion criteria was primarily to those patients who had overlapping populations or non-English publications were excluded, and this meta-analysis was done. So they, in the results we can see, they had around 3,354 patients from 4 observational studies, of which only 19.5%, that is 656 patients received neoadjuvant chemotherapy with platinum-based chemotherapy, and the follow-up time was between 15.9 to 74.4 months. It is very, the review showed, the systematic review showed that there is no significant difference in the overall survival or in the disease-free survival when these patients received neoadjuvant chemotherapy before chemoradiotherapy. And the hazard ratio is also almost 1, And you can we can also see on the forest plot that there is not much difference in, not much significant difference. So based on this analysis, the conclusion is that there is no survival benefit from adding neoadjuvant chemotherapy to chemoradiotherapy in patients with muscle-invasive bladder cancer. However, and this conclusion also summarizes the previous paper, that the quality of the evidence is very low, largely due to retrospective nature. The previous paper was also a retrospective chart review. So we need further randomized clinical trials and to clarify the role of adding neoadjuvant chemotherapy in bladder preservation strategies in non-metastatic muscle-invasive bladder cancer. Thank you.